Okay, so now those cases in Broomfield, they're just the latest patients in Colorado to test positive for measles within the last few weeks. Just last week, we had a different case. Health officials have issued a warning about an exposure at DIA because there was a traveler coming in and out of our state through the airport who was also positive for measles. But this case is different because that patient was actually fully vaccinated. So I want to dig into some questions around that today. Joining me today, I've got family medicine physician at AdventHealth in Littleton, Dr. Ming Wu. Thanks for being here today.
Of course, thank you for having me.
In primary care and family medicine, I'm sure vaccinations are always top of list, but here we have a patient who was vaccinated and tested positive for measles. I guess my first question is, that can happen?
Yes, so if you have both vaccinations for measles, it's about a 97% effective rate. Unfortunately, that means for every 100 people, there are 3 that are vaccinated that do end up getting measles. Thankfully, however, if you do get it, it's usually less, it's a milder case, and you are less likely to pass on the measles if you do have the vaccine.
So it's really a knocking down of it, of course. It's never, which we know this about vaccines, they're never going to be 100% effective. That will probably change some of the potential transmission then from a patient like that. We don't know. I know the health department now is doing the contact tracing part, but I feel like maybe the public, the risk would be a little bit lower if that person in particular had been vaccinated.
Yes, it is highly likely that if they did get sick, they're probably not as infectious. You'd have to be exposed longer, or you'd have to be in close contact to really get any infection.
Okay, we are seeing measles cases both here in Colorado, around the country, and a lot of these cases are in vaccinated people. I think that's just kind of jarring for the folks in this country who are vaccinated, thinking, oh, I figured I was fully protected. But are we seeing this more commonly? Are we seeing it because there are outbreaks happening? What's going on here?
So I think a lot of it has to do with numbers. If you have more cases, like I said, with a 97% effective rate, you're still going to get cases of measles. And so you're going to have more cases. If you have just more cases overall, you're just going to have more cases of people that are vaccinated who get measles. But again, thankfully, they're probably milder cases and nothing we're going to have to, they don't have to worry about being deathly ill because they are vaccinated.
And because there are just more cases going around.
Right.
So to your point, the numbers game. Measles vaccination, that's something a lot of people are getting just as children. Talk about the immunity over time. I'm hearing a lot of adults talk about now they're getting kind of a boost just to make sure they still have immunity. You can test your immunity for this?
Yes.
What do we know about the waning of immunity over time?
So the traditional thinking is that for measles, it's actually lifetime immunity if you get both vaccinations. It is a 2-shot series, although...
But that changed. That changed the series back 20 years ago. Okay.
Yes, it used to be 1, you're right. And so a lot of adults only had 1. They have proven it was like I think one vaccine gets you about a 93% effective rate, 97% if you get both. So it's still a very good vaccine. But yes, some people are concerned, and if you are, you can always go to your primary care provider. They can order what's called an MMR titer. We can actually look at your antibodies, make sure you're immune. If you're not, you can get a second dose of the measles vaccine. It's pretty common to do. In fact, if you'll know, a lot of pregnant ladies will test them for rubella, and if they're negative to rubella after they give birth, we'll actually give another MMR vaccine to protect them from rubella, and it just happens to also protect against measles and mumps as well.
I see. I'm sure this has been a hot topic among your patients, especially if you're in family medicine with families and little kids. How do those folks moving through life vaccinated but nervous about this, what do they need to understand about their risks and their limitations and they're nervous?
And I totally understand that. And what I would say is I would live your life as normal. If you are both vaccines, you are 97%, you're not going to get it. And even if you do, it's probably not going to affect you all that much. Of course, you always want to be safe. Hand hygiene is always important. If you're sick, please wear a mask, cough into your arms or cough into your hands. Make sure you're washing your hands frequently and just making sure you're just staying, hand hygiene and just making sure you're staying safe.
A lot of these measles cases that we've been covering are adults. These 2 students are technically, I think they're juvenile students. I'm actually not sure if they're above 18 or not, but they're younger people, right? Yeah. When we talk about measles risk, who is at most risk for the complications from measles?
I mean, usually it's the people you would expect. So the elderly, the very young, people, of course, who are unvaccinated, and then people who are immunodeficient. So people who have cancer, people who are on medications that would prevent their immune system from reacting. And so those are the most vulnerable populations, and those are the ones we're trying to protect with the vaccine.
I see. It's just wild that we're talking about measles so much in the last year. I've talked to so many doctors who say, I can't believe in my career I'm even discussing this because we kind of thought we had a handle on this.
Right.
Is this just bizarre in healthcare to even have these conversations?
We talk about it a lot, in my practice as well. It's just we're living in wild times is all I can say.
But everybody also is just having more conversations about infectious disease in general, I feel like, since COVID. COVID has kind of shaped how we view all of these.
Of course.
So, okay. Yeah. Dr. Wu, thanks for your help and your perspective. We really appreciate you coming in today.
Yes, thank you for having me. Appreciate it.